It's more common in females ages 40 to 60 years old. That's where you're going to have that pain on the outside of your hip. It can be sensitive just to press on, to touch, difficult to lie on in the bed. It can radiate down the leg. It can radiate around to the glute area. And so this is something that can be irritated from either mechanical stress. You've strained it. Maybe you were running or you did something too fast. You strained and irritated that area. Or this could be from a repetitive strain injury, just repeating the same movements over and over again. You've irritated that. Can also be from lying on it for too long or too much pressure in that area. That can cause some irritation there. So some general tips that you can do at home right off the bat is try to avoid sleeping on that side as best you can. I know a lot of times we can't control how we sleep, but at least how you start sleeping. If this is my left side that's irritated and affected, try not to get on that left side. Take some pressure off of the bursa sac. The other thing is try not to shift your weight. So again, we're going to say it's my left hip, and a lot of times when people are standing, they'll shift their weight to that side. And so try not to do that, because that IT band that travels over that and the muscles in this area that come down, those can pull and kind of tension down on the bursa sac. So that's going to increase that pressure and compression, so try not to do that. So the first thing we're going to do is work on some stretches. And so one of the stretches that we're going to do is going to be a knee to chest. So you're just going to sit, pull your knee up towards your chest. You're going to feel that stretch on the bottom side of your hamstring there, as well as in the glute muscle. And you're going to hold that for 15 to 30 seconds and then just relax and repeat that for several repetitions. So I'm going to cross, we're going to say my left hip is the side that's painful, it's affected. I'm going to bring it across here, just that in that position, you're going to feel some discomfort there more than likely in the outside of the hip. And then I'm going to take my hands, clasp my fingers together, and I'm pulling my knee to my right shoulder. So I'm pulling my knee across my body. So I really feel that stretch across through here. And I'm going to hold that for 15 to 30 seconds and repeat that several times a day. Now we're going to take this tennis ball. Again, if you've seen my videos, you know I'm a fan of using tennis balls for a lot of orthopedic conditions that can be treated in therapy. We're going to take the tennis ball and put it right on the glute back here, right where you're having some of this pain. Now I know a lot of times you're going to be most sensitive around the outside, but you are going to get some of that referral pain into the glute. And just by putting that tennis ball there and that pressure in that general area should give you some relief with your pain symptoms. So you could do that and maybe use that tennis ball for 3, 5 minutes, maybe 10 minutes. If you're just sitting around watching TV, or if you're in your vehicle, of course not driving, but if you're a passenger, you can just sit on that, hold that pressure, just to try to get some of that hurt so good relaxation of the muscles.